not presenting could mute their Zoom, that would be perfect. And Peter is going to introduce our speakers.
Good. Glad to do it. Welcome, everyone, to something that's very close to my heart, and I know close to the heart of many other folks, issues of assessment, monitoring, and evaluation. I'm glad to be the moderator today. I'm honored to present two key people. And the first, with just a brief biographic sketch, is my longstanding friend, Brima Apambire. Hi, Brima.
Hi.
Nice to see you.
The same, thanks.
Brima is the director of the Center for International Water and Sustainability at the Desert Research Institute based in Reno, Nevada. Wide-ranging career based on his field work, his academic and teaching expertise. He's an author of professional articles, a grant maker, and of course, a management expert. And among other things, again, close to my heart, he's a key proponent of circuit riding. Our other featured guest is Stuart Martin, a new friend of mine. Brian is an old friend. Stuart's a new friend. Hi, Stuart.
Hello, good to be here.
Stuart is an engineer and self-described recovering lawyer. He works, among other things, with the Rotary Wash Action Group. As a Rotary Wash specialist with Erica Gwynn, he's led teams revising the Rotary Foundation's WASH guidelines. These have been essential worldwide. For Transform International, he is a relationship manager for 3 East African NGOs. And in 2016, he received the Rotary Foundation citation for meritorious service. So with those introductions of our 2 key guests, take it away.
And I'm actually going to start by asking you guys some questions that Stina and Brima wanted to know. Obviously, we are all here in Colorado, but for the people that are online, where are you calling in from?
I don't think I can hear you very well. You want to come and switch spots with me?
Sure.
Okay.
Thank you. Hi, Zoomers. Can you guys hear me okay?
Yes.
I was just saying that our presenters had a couple of questions. If the people on Zoom could answer in the chat.
Katie, Washington, Fort Collins.
Cool. Great.
And,
Thanks, guys. And most importantly, is there anything that you're hoping to learn today in this presentation, anything specifically? And obviously our in-person participants can answer as well. Otherwise, we will have our speakers take it away. Thank you.
Thank you, Emily. I'm going to share the screen and let Brima take over here. Can you see that?
Yes.
Yeah, so good morning, good afternoon, good evening, everybody. I think one introduction of me that was left out is that I also belong to the Rotary Club of Reno. So I joined about 5 years ago. But thanks for all of you coming and the opportunity given to us to present on how to do sustainable projects with assessment, monitoring, evaluation, and resolution. This is a very important topic for our WASH sector, not only WASH, but different developmental sectors. We've already covered the opening questions. We will be doing a little bit of overview of the why of project assessments, monitoring, evaluation, and resolution and learning. And we will also cover global grant WAS projects. You heard that Stu has been very much involved with revising the guidelines for global grants. So Stu will be covering that. And then we also, since this is an advanced breakout session, we want to illustrate some of the assessment, monitoring, evaluation, and learning through certain projects that Stu and I are involved in. And then Stu will also talk about value of project M&E training with examples from Indonesia and Kenya. And then there will be some joint topics, and we want to leave enough time, maybe 15 to 20 minutes for question and answers. But since this is a small group, as we present, if anybody wants to interject with a question, you can do that. So
in another room with this session, just on the other side of the hall. So there's 8 seats if anybody wants to move for more room. Okay, it's live right now. Thanks, Brian. I'm sorry.
That's okay. So just some basic definitions, and I know most of you know these definitions, but we thought we should start with some basic definitions. An assessment of a project is a fact-finding mission which helps to identify inputs for project design. We all know that when we begin to think about developing a program, we need to assess it. And this assessment, we do it in collect various forms of data, that will include geographic data of the place, health data, a needs assessment, key stakeholders. So there's a variety of information that we usually will gather as we assess to design the program. And if you don't do this rightly, you probably will not be able to put together a very good program. And through the assessment, we design a program. And then in the implementation, there is also a lot of management of that program. So the assessment actually, when done properly, will lead to a very good program design. I know we do a very good job in Rotary, but we need to make sure that we are assessing properly before we design the program and bringing in all the key players that are needed in a community or a district. Monitoring, we develop indicators, and Stu will be covering log frame. But in program design, we usually will come up with what we call indicators. And we also perform what we call a baseline. The baseline is usually used to track changes of those indicators. So monitoring uses indicators to measure the effectiveness over time, including during the life of the program and post-implementation. Post-implementation monitoring occurs after the installation of the WAS service or completion of a discrete project. Post-implementation monitoring has become so important for us, and as Rotarians, we've talked a lot about sustainability. There are projects that we do just project implementation monitoring, baseline, we do midterm evaluation, and end of project evaluation, and that is it. That doesn't lead to project sustainability. It is also the post-implementation that is very, very important for a program to be successful. Evaluation is a long-term systematic and objective assessment of an ongoing or completed project, program, or policy, and its design and implementation and results. As I indicated, when you set baseline and say your program is for 5 years, maybe 2.5 years, you measure those same indicators and compare with the baseline so that you see what is the outcome of the program mid-year. It is advocated that evaluation should be done by an independent group so that there is objectivity. But there are instances that is, members from the project team and an outside team could be put together to do an evaluation. An evaluation allows us to compare the results so that we can have some corrective measures. In the last 5-10 years, we've also had what we call resolution. You don't only monitor, especially after program implementation, you need to resolve some the issues involved with the water system, sanitation systems. Learning has become very important, and that is a feedback loop into improving on the project effectiveness over time. So learning is a very key thing. You share lessons internally to make sure that you are correcting the program, and then also externally so that others learn about what you are doing in the project.
Prime, I have a question for you.
Yes.
Is monitoring, evaluation, resolution, and learning only done at the end, or is it good to do it midway and feed back into the implementation?
It depends on the program. If you are having problems within 5-year program with certain systems, you need to resolve them. But learning is a continuous process. Right from assessment, there's always something to learn to improve on the project. So learning is a very, very continuous process and very, very important. We did it in WASH for many years, but it wasn't standing on its own. So it kind of was buried. So MEL, has a learning component. Why do we do as proper assessment, monitoring, evaluation, resolution, and learning? We all know that there's a lot of, breakdown of water systems or WASH systems. There's poor functionality, and this has become very important for us for a continuous, MEL program, especially for most of the programs that we Rotarians get involved with. There are small water systems that are developed in rural communities who don't have the capacity, they don't have the resources and the spare parts. So it's very important for us to set up this monitoring system that will lead to sustainable programs. It is estimated that, there's about 1.2 billion that has gone wasted because of certain projects that have not been sustainable. So MEL takes a holistic outlook of projects to answer the question, why do projects fail and why do projects succeed? If done properly, it leads to long-term sustainability of projects. Who should be involved? As I already indicated, you need to have the donors, implementing organization, national, local governments, and of course, the communities are the key partners in this, whom we Rotarians empower so that they can take charge of their own development. Now, the question as to who should be involved also depends on the size of the program. If it is a very small program in a small community, maybe the partners probably will not be as many as a district-wide program. But it's very important to get all the key stakeholders involved actually during the assessment. You don't wait until you are implementing before you bring together, the key stakeholders. Especially if you have to succeed in long-term sustainability, you need to bring in the right partners whereby roles and responsibilities are identified. And life cycle costing of the project is also done so that we know how much is needed, to maintain water services after the project is completed. For how long, I already indicated it's a continuous process, especially after the program implementation is ended, is even more important to keep monitoring the program and be resolving issues. At what cost? We need to build in, a special post-construction cost when we are designing a program so that, midway projects are not being able to fund. And then I will come back to talk about this in our circular program, how you set this. Now, this is a schematic that looks at how you identify a program, assessment, design, planning, implementation. And you see, I don't know whether it was Stu or somebody who asked about learning. Learning is always done. You see that all the arrows are pointing into learning. And there's implementation and monitoring, evaluation. You learn from that. And that feeds back again into identifying new programs or correcting the program that you are implementing. So this is a schematic that I use to teach my classes, and it is in the PowerPoint. And you can use this also as guidance. So this is the end of the basics, and I'll turn this over to Stu.
Thank you very much, Brima. Great introduction. What aspects of a project create sustainability? That's an important question to think about at the beginning. What makes it sustainable for a long time? Well-designed, fully implemented, engaging the community. Who's involved and how does that happen? In Rotary, we think that financial, technological, social, cultural, and other ways are methods of sustainability, and I've given you some bullet points underneath those. TNSTOFL is an old acronym for there's no such thing as a free lunch. Water delivery at a household or at a tap isn't free, neither is sanitation, nor hand washing with soap. Those cost money, so they have to be built into the financial planning for the project. The community or households, which is it going to be? A community-based water system or a household individual system with filtration or treatment? Wash in schools, is there going to be a curriculum that is part of the regular learning program? Is it budgeted? Will the teachers honor it year after year? Is there a repair and replacement fund for the infrastructure? And the same for washing healthcare facilities. On the technology side, is the concept for this project the right design for that location? Does it use appropriate technology? I'll show you some pictures later of a rainwater harvest project in which we installed gutters, but the people wanted to use bamboo, and they ended up prevailing. Is there a supply chain and a market? Can you help create demand for wash so that people want to buy water filters or toilet pans? That's part of the technology. On the social and cultural. Yes.
Stu, sorry for interrupting. Someone said they're having a little trouble hearing.
Okay, I'll try and speak up. Is that better? On the social and cultural side, an assessment done using the Rotary Toolkit is a really valuable way to understand the community. And I recommend that it be a thorough assessment of all their needs, not just the ones you think about, that it be unbiased. Don't come in with your ideas, come in just listening. Ask a lot of open-ended questions so that you know what they want to hear, or what they want to have met. And it's multifaceted. It's not just water, sanitation, and hygiene. It may include waste prevention. It may include wood collection. It may include job creation. So listening fully to the community and learning their culture and how are differing views and voices handled in that community. How are women speaking up and respected, or are they? How about young people? How are they involved? How are elders involved? Single older women living alone? And is this project really going to be a community-driven project? How are the decisions made in the community, and how will you know that it's the community's project, not just one that you think is a good idea? So I think it's important to include the community at all stages, from the needs and the assessment, all the way through the choice of materials, what their contribution will be. Local materials and volunteer work is usually part of that, but maybe ask them, what else can you do to help your system come together? How about the location of things? In Guatemala, there was a wash project where the Rotarians realized the women needed a place where they could wash clothes. So they positioned some new lavados in the center of the community, because naturally that was near the water and convenient for access. Within a couple weeks, the women stopped using them. They went back down to the river and the dirty water to wash their clothes, because it was the place where they could visit and talk to each other away from the view of men. So taking those social and cultural matters into account for location, for design, and for what choices is important. Now these next, I'm not going to read these to you, but take a look at these next couple slides. This is how we as individuals can do WASH work better. I have found that most of the work is a matter of self-study. Getting to know the Rotary documents, the terms and conditions, the guidelines, the area of focus policy statement, the conflict of interest rules, that's very important. But also attending WASH seminars and conferences like this one, or WEDIC, or the UNC conference that was just held. Those are really valuable ways to learn what other people are doing, what other organizations are doing in the world of water, sanitation, and hygiene. I will send to our leaders a list of resources, websites, and other places that you can use to improve your own skills. I recommend in your club and in your district, get some coaching, form a network, maybe even a community of practice for your region or the place where you're serving. That way you can share issues, you can learn from mistakes, you can anticipate things. And you definitely want to build a strong, consistent collaboration in that region. If you work with the same partners, both Rotary, NGO, and local government, you will be able to improve the methods, use continuous process improvement, build capacity in the long run, and create a learning culture in that community. Share stories, and obviously the community involvement is the first and the last aspect, because this is their project and their community that they live with. Here's some subject matter topics that I recommend that you think about in your self-teaching and your growth as a WASH warrior. I'm not going to go through those, but there's some interesting ways there that you can get information and also form a Rotary Community Corps and manage your own growth. I'll just show these briefly. This will be available to you after the program. Learn the country's rules, plans, and strategies, and how they filter down to your district or your community. How are they being implemented or not being implemented? And you may become a peacemaker, especially the host Rotarians, in how to resolve conflicts and make sure that diplomacy is happening in the community. There's some little technical tips. I particularly like Otter because I can just dictate something or have a meeting and get a transcript. And screencast is a way of putting together a simple video that you can explain things. So Brima, we're back to you to talk about circuit riding and implement.
Chris has his hand up.
Yes.
I don't,
Chris.
yeah.
Go ahead, Chris. Unmute yourself.
Thank you very much. I'm Chris Roselle. I'm in Kansas, and I didn't see a formative evaluation in the design of the project. I did see the community participation in the design. Also, do you include diarrheal incidents in your impact baseline and final evaluations? The relevance of diarrheal incidents is, of course, it's the first or second major killer in most countries. And if we do WASH but don't affect diarrheal incidents, we may have missed something.
No,
it's a good indicator of whether we've missed it or not.
Yeah, no, I agree with you, Chris, and Brima may add to this. Finding out the cases and the incidents and the absenteeism caused by diarrhea is important for the baseline and also for the project design so that you can have monitoring of that health measure. Brima, do you want to add anything?
Yeah. So, Chris, those are all the at the assessment level. You need to collect all that, and that informs you about the design. Health is a key thing. The reason why we do WASH, one of the major things we do WASH, especially diarrheal diseases. The trick though in evaluation is attribution, because it's not only water that reduces diarrheal diseases, even though water is the major thing. So we have health people to working on diarrheal diseases. And as WASH professionals, when we go into a place, we want diarrhea to reduce in 2.5 years, 5 years, depending on the program, the time of the program. And so after 5 years, you also need to find out, has diarrhea actually decreased, either through your household surveys or maybe with the health ministry. So there are things that you need to track. If it is a very small program, it might be difficult for program staff to really pin down diarrhea because of attribution. There are various things that reduce diarrhea. We have curative aspects from the health side of things that also reduce diarrhea. But Chris, we include those assessments as baseline, and then also midterm evaluation, final evaluation, and then also post-project implementation. Those things need to be followed. So we wanted to illustrate our session with some projects. And I saw a comment by somebody talking about the most important thing that, people should be helped with is the post-construction. And that is true because a lot of money is wasted. And we don't usually follow up with post-monitoring. So one of the projects that the Desert Research Institute, where I work, we did with WASH RAG and my Rotary Club and several clubs, was to go back to assess projects that were funded by Rotary in Honduras, and look at, several years later, what is the status of these water systems. So Rotary has up to, at the time, about 90 sponsored water system in Honduras, and invested over $5 million in those projects. And as I indicated, DRI, WASH RAC, Rotary Club of Reno, local Rotarians, Rotary clubs, both in the US here and Canada, contributed to this project. And we did an assessment of 34 of the water systems. Next, please. So we developed survey tools and trained AHASA staff. AHASA is a local NGO in Honduras that we worked with. We did inspection of the water systems, right? Most of them are spring sources. So right from the eye of the spring down through the piping lines to where the water is being used to find out what the problems were. We also did a lot of water quality sampling and testing. And this was done, in the 34 water systems that I talked about. Next slide, please. Some of the problems we identified, the projects range in age from about a year to over 20 years. And some of the problems that we identified was that the water boards, that were created maybe 15 years ago hadn't been trained again. Some of them had left, their roles because they were volunteers. We also realized that most of the chlorinators for the water systems were also broken down. And there was a lot of contamination of the water from the watershed. Some of the water systems were highly polluted, even at the drinking water was highly polluted with microbial matter. So some of the recommendations that we came out with the assessment was that we needed to train operators, community members, in the general maintenance of the watersheds and water system infrastructure, and building capacity on ongoing technical support for water boards, tariff setting, life cycle costing. And this training was supposed to be done through what we call our Securata program, which I don't have time to discuss now, but it's a methodology that DRI uses in terms of, building long-term sustainability of water systems with community members and water boards. We need to improve on water quality testing and water handling protocols at home, and strengthen sanitation and hygiene behavior change.
Keaton Jolly Rao.
What is it?
Can you mute yourself?
And create and keep up-to-date maps for distribution of water systems, and then undertake minor water repairs on some of the distribution systems. I must also say that with the assessment, almost over 90% of the water systems were still functioning, except that they were functioning suboptimally. Water quality was a very, very big issue. And then we have a problem with the water boards managing the water systems. And tariffs that were set about 15 years ago were still the same tariffs that were being charged and needed to be revised because the municipalities didn't have enough money to maintain these water systems. Next slide, please. One project that I also want to highlight, which is also a post-construction assessment, is in northern Malawi, Rumfi district, where DRI and Transform are currently working. Next slide, please. The project is being implemented by the Desert Research Institute, my institution, Transform International, DAMRA is a local NGO, and the district coordinating team. We want to make sure that we're building the capacity of the district and the healthcare facilities so that they are taking charge of, making sure that there's long-term sustainability for the wash systems. So we did a landscape review, which involved a lot of assessments of these 18 healthcare facilities. And then we are adopting the Securata model, to develop a long-term sustainability system for the healthcare facilities. We did a baseline survey, and from there we'll be monitoring activities. We also have had funding from the Canadian government to also test a system we call Streams. And Streams is bringing in other program activities like gender mainstreaming. And as most of you know, healthcare facilities have peculiar issues because we also have a lot of nurses to train, and there's high disease incidence in healthcare facilities because of the patients who go in there. So the ultimate goal is to develop and pilot a male framework incorporating capacity building, operation and maintenance procedures, monitoring and evaluation for healthcare facilities. We hope to replicate this in other countries. And we don't have time now, but there is documentation that we can also provide that some of you, if you are interested, you can read more about this. Next slide, please. We launched our training programs in June 2021. We've conducted trainings. We did an introduction of the program with key stakeholders in Malawi. This was a Zoom meeting that had a lot of participants in it. We've done training in WashFit tool among our circuit riders and key stakeholders in Malawi. We've done wash training in basic wash training using our circuit rider model. This was done in July. We've done hand washing and cleaning training for our quality of care circuit riders. And we just recently done another training on mechanized water systems for our circuit riders. The idea of this is to empower the circuit riders who work with the healthcare, administrators to keep water and sanitation facilities operating. I'm headed out to Malawi with Nancy Gilbert and some of our partners in later this month, and we'll be conducting series of workshops again in water quality. We're doing a lot of data collection and reporting, and then monitoring and evaluation learning. Next slide, please. So as I indicated, we will be doing our MEL program with a number of monitoring indicators, as well as some evaluation indicators that we'll be using to monitor our program. The monitoring is ongoing. And next slide, please. So our next steps now are our circuit riders will start visiting. They've already, repaired one water system in one healthcare facility. Again, for long-term sustainability, we need to have the healthcare facilities and district be responsible through our life cycle costing approaches so that they know what is required of them. And we'll be doing repairs of 6 water systems and hoping to bring in the communities that also are supplied with water from these spring sources. Currently, we are emphasizing on the healthcare facilities, but ultimately we're bringing in the communities as well. So these are 2 examples that are post-monitoring and developing long-term sustainability frameworks for these programs to be viable with time. So Stu, I think that's the end of my presentation.
Thank you, Brima. And folks, if you have a chance, look at the chat. There's some interesting comments by Lee and Chris. So I'm going to point out here this value of long-term monitoring and evaluation and retraining using an example from our project in Sumba, Indonesia. I'm going to change the sharing to some pictures that I have for you. Can you see this picture okay? Or just do you see the collection of images?
We just see Stu Martin, Rotary TI Transform International has started screen sharing.
Okay.
So click on what, there you go. Now we saw it momentarily.
Yeah, I'm going to change it here.
For anyone of you who would want the chat, I can save it, save the Zoom chat, and you can give me your email and I can send it.
You're breaking up, Emily.
Oh, I was just talking to the in-person attendees, letting them know that I can save the chat.
Good idea.
Yes.
So, can you see this slide from about 10 years ago?
Yes, we can.
This was a presentation which Ron Denham, Bob Wubben, and I made at the Bangkok International Convention. And I think these same items are still true today, plus we've learned a bit more. I truly believe the concept here in this program that the Blue Thread of WASH supports all the areas of focus. Now, this is a project in Bali in which the Rotarians wanted to use a spring to bring water to 8 villages as one of my early projects. And here we have villagers hauling pipe up the hill through the jungle, making supports out of bamboo and wood, building bridges. It was quite a community involvement project. Now I'm switching to Sumba, Indonesia, a very primitive island where the average education is 3rd grade for adults. Imagine average education, 3rd grade, very simple life. In this community, every springtime, the priests take the community out into the ocean and look at the glowworms and see, are they the right color and sufficiently large? And if they are, then they have a festival in which horseback riders draw blood to make the ground fertile and to make the plants grow better in the spring. This is a typical family, multiple people living in a grass shack, very simple life. Some of the small children, their bellies are filled with worms and they don't get good nutrition because of that. We learned new ways to greet people, which was very fun. Laughter. That's Bill Chapman, my cohort from Australia in this project. We partnered with an NGO that was really very good at training health programs, and we added to their curriculum water, sanitation, and hygiene. And we chose rainwater because this is a limestone island. It's very difficult to do boreholes. You get a lot of salt water or nothing at all. And also the groundwater is frequently polluted. So we chose rainwater because 5, 6, 7 months of the year, a sufficiently sized tank could feed water for a family of 5, 6 households. They used their machetes to cut the limestone blocks or use individual coral rocks to build these tanks. So they did the work. They participated in the design. When the tanks created repair problems, they fixed them. But you'll notice here we have the pipe, which was store-bought by Rotary, installed with a first flush system for the rainwater tank. Over time, they replaced any problems with that pipe or with the guttering with bamboo. They're very used to bamboo. They use their machetes to cut bamboo, take out the septums, and split it in half. And in just a short time, they can have a guttering system. We found that based on the survey we did and the conversations with people and a test that we built and they liked, that a 3-hole EcoSan toilet would be the best type of toilet. We sized the main poop hole so that children wouldn't be afraid of falling in. The urine was collected in jugs in a vault below, and the feces dropped into a basket. We taught them how to make this locally, so it was built locally from local materials, and of course hand washing using Tippy Tap's simple method. That part went well. Unfortunately, even though these wonderful colorful pans were made locally and they functioned well, when it came time to use them, we found that people didn't really want to use them as they were trained. Here, by the way, this older gentleman in the back in the white shirt donated land so that there could be a solar collector that would speed up the drying process of the feces. We even had little buttons with logs and data logging the temperature so we could know how quickly to move the buckets from the household buckets to these solar dryers. It was a really good design, but I will tell you that the people didn't like cleaning these toilets. They didn't like handling the feces in the buckets underneath. It gave them a sense of disgust. They didn't properly keep the tubes fitted, so urine leaked and started smelling. And pretty soon we were getting this sense that people just didn't like them. So we had a meeting and we proposed other styles of toilets, explained the disadvantages, and they selected a pour flush latrine. Here you see a simple toilet made with a frame, concrete, a water bucket, a place for water in the middle, a water box they call it, and then a toilet. And these families were so proud of their toilets. They don't smile much, but I can assure you that they were able to say, I'm proud, I have dignity, I can show my toilets to my friends, and they kept these toilets very clean. Even 3 years later, I've just received some pictures. They're well implemented. They're still using the first flush system on the rainwater. They're keeping their toilets clean. So it's really important to have not only tests, but to give people full input, give them an opportunity to get acquainted with toilets, and then choose the one that they want. I'm switching now to a project in Kenya, Western Kenya, Kisii County, where multiple clubs, multiple districts raised $260-some thousand. And by having a partner that we could trust in Kenya that had worked already for years in WASH, we found a way to augment what they were doing. We're now in phase 2 of 4 phases, doing 37 schools and 70 healthcare facilities. They're strategically located throughout the county. In that way, those can become models for the surrounding schools, the surrounding health centers. The partnership has taken about a year to put together, but it is functioning really well. There are weekly meetings with the Rotarians and the NGO staff. There's a careful review process for each of the decisions. There's a baseline assessment. I was there a couple months ago, despite COVID, and the implementation has gone quite well. I spotted some problems, but from the broken down toilets that you saw to see painted locked doors, functioning toilets, drinking water filters where the children can get water anytime they want, it's quite a change for these schools. We're using these Sato pans developed by a sanitation company in Japan. They're now very popular, becoming popular in East Africa, Kenya, Tanzania. They have a plastic flap underneath with a counterweight. So for about $8, you can have all the smell and all the flies kept from coming into the room. A wonderful addition. These children were very keen at looking at me as a tall white Mzungu foreigner. I was keen at watching them wash their hands. And I'll just say that because of these projects like this, we're able to bring joy and the celebration of water to children. So that takes care of this part. Now, we are back to, yes, the guidelines. So I'm going to share with you some secret wash draft guidelines. I say secret because they're not yet published. They're not for distribution, but we have the opportunity to look at a few aspects of them today. Where are they? Yeah, so these are some key elements in these new guidelines. I'm going to open up the actual document and share that. There was a group of WASH practitioners like you and me that were picked by Erica Gwynn, by the cadre manager, Christian, by WASRAG, as a working team. And then there was also a consulting team. Brima was on the consulting team. This is the table of contents, and you'll see these core elements of sustainability are intended for every WASH project. Community assessment, what type of materials and resources, the planning, the training. There's a new section on behavior change, improved section on MERL and governance. Oh boy, we have a notice to leave the breakout room. Well, I'm going to stop sharing. We've used too much time. Do you have some questions from the audience? Let's try that.
When will that guide be available?
Any month now. It's being edited by the staff at TRF. It was submitted to them end of March. It's still in the process of being edited. There's 7 new guidelines for each area of focus coming. Hopefully this month or next. Other questions? We got 70 seconds.
Does the session really end in 2 minutes? Or it says it goes to 9:35.
Yeah.
10:35. Wait, yeah, till 10:35. So is there any way to override that we're going to be cut off in a minute?
I don't know how to do that, but maybe Emily, you can help, or Chuck.
So that's controlled by like our main Zoom room. So it's automatically broken up, so at least I don't.
Okay.
But if you guys don't mind, I will provide your emails. And if anyone has questions, it can be sent. I saving the chat as well. So I'm putting my email in here, and just reach out to me for that if you would like it. Thank you all so much. Yeah, I think we're
At the end of our presentation, we'll give both
Yeah.
of our emails and phone numbers also.
And we're back.